morning and welcome to this meeting of the Adult Health and Social Care Policy Committee. My name is Angela Argenzio and I chair this committee. The meeting, so welcome to everybody who's in the room. We have some members of the public, some observing students on placement. So the meeting is open to the public and press. There's one agenda pack. It's in 2 bits, and there are some paper copies over there if anybody wants to grab one. The meeting will be webcast and the recording will be available for people to view later through the council website. It is also possible that Sheffield Live TV will record and rebroadcast this meeting. Please can I request that mobile telephones and any other electronic equipment is switched to silent mode as to not disturb the conduct of the meeting. There is no fire test planned today, so if there is an emergency evacuation, please take instructions from the town hall staff, and the assembly point is Tudor Square. I will now ask each committee member to introduce themselves, starting from my left.
Morning everyone, I'm Laura McLean. I'm a councillor for Walkley Ward and the group spokesperson for this committee.
Councillor Mary Lee Darnell Ward.
Morning, Councillor Ruth Nelson, a councillor in Crooks and Crosspool Ward.
Good morning, Councillor Jane Dunn.
Hello, I'm Christine Gilligan. I'm a councillor in Hillsborough Ward.
Councillor Will Sapwell from Stannington.
Morning, Councillor Sophie Crossthorne from Beechif and Greenall Ward, and I'm the Deputy Chair of the Policy Committee.
Thank you. I'm going to ask the officers to present themselves, starting with Matt.
Good morning, I'm Matt Bowsher, the Strategic Director of Adult Social Care for the Council.
Morning, Sherry Grant, Assistant Director, Legal Services.
Good morning, I'm Amanda Clayton from Democratic Services.
And we also have Claire that is doing the tech. So item 1 on the agenda is apologies for absence. Amanda.
Thank you, Chair. We have apologies from Councillor Mick Rooney, and Councillor Mary Lee is the substitute today, and also from Councillor Steve Ayres.
Thank you. And there are no items on today's agenda that require exclusion of press and public. So I'm going to go on to item 3, which is declarations of interest. Do any members need to declare any interest on items on the agenda? That's a no. And we go to the minutes of the previous meeting. These are on page 11 of the pack. I will ask whether members agree that this is a true record of the minutes, and then I will go page by page to see if there are any matters arising. Do members agree that the minutes are a true record of the meeting? And I will go over, so I've got page 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, and 22. Okay, so I will sign the minutes if members are happy. Brilliant, thank you very much. And item 5 is public petitions, questions and statement. I will hand over to Amanda.
Thank you, Chair. So we've received 2 public questions and 1 statement for this meeting, and also 1 supplementary question. The answers to the public questions have been published on the Council's website and distributed to members. So we have Johnny Feldman and Hilary who are here to ask a supplementary question. Would you like to come forward?
Thanks, Hilary.
Is that the right button? Yes. Thank you for your response to my question, outlining the clear expectations of this committee In view of the existing contract between NHS England and Palantir and the overwhelming level of concern about Palantir, as referenced in Rory Gibson's question to this committee and also as referenced in the public questions and statements that were submitted at the recent Health Scrutiny Subcommittee, will the chair of this committee now write to the Integrated Care Board and also to Sheffield NHS Trust outlining these concerns in detail?
Thank you, Hilary, for the question and the supplementary question. My very direct answer to the question is yes, I will write to the NHS Foundation Trust and the Hospital Trust with the concerns as outlined and as expressed, you know, in the Health Subcommittee. I want to put this on record now because obviously we're going into pre-election period, so I assume that the letter will be delayed a bit. But what I will do is when the letter is ready to go and is sent, I will also ask for a copy to be sent to you so that you can see the letter. I'm sure it's going to be published somewhere. But yes, the answer. The pre-election period starts on Friday, so the PERP starts on Friday officially. So I don't know whether it's possible to get a letter together that quickly. As you know, I know that my policy officer is not here this week, so I know that it will be delayed. But we will certainly do it as soon as possible, and I will ensure, you know, I'll chase it up myself. So thank you.
Thank you. And then we have Peter Jones to present his statement.
Thank you very much for the opportunity. Those personal statement on Palantir again, although I hope you understand this represents an enormous body of public opinion united on this subject. The Health Scrutiny Committee recently debated the adoption of Palantir's federated data platform by Sheffield Trusts and Integrated Care Boards. Councillors expressed serious reservations about Palantir, echoing public statements and questions received. Not one representative of trusts or ICBs attended the meeting, a failure of respect on their part. The issue of joint commissioning is a first test of the new ethical procurement policy of the Council. Palantir is complicit in the economy of Israel's genocide. Its systems have been knowingly used to generate targets in Gaza and enable Israel to commit war crimes. The company's contract with Israel specifies its war-related focus, and Palantir's boast is "we stand with Israel." In other words, the company supports a regime committing war crimes which the ICJ, ICC, UN Commission of Inquiry, and numerous human rights organisations, including Amnesty International, have documented. Anonymity of patient data under Palantir is actually reversible. Lack of patient confidence can therefore lead to refusal to allow data to be used. In the US, Palantir has been used by Trump's ICE to target vulnerable asylum communities. What fate awaits our elderly and vulnerable residents? You must apply the ethical procurement policy rigorously, not entering joint commissioning activities with trusts and ICBs unless Palantir's exclusion is guaranteed. Thank you.
Thank you, Peter, for your statement. I'm not going to, we don't normally do like an answer, but thank you for that. Thank you for making the time to come in. So we are moving on to item 6, which is members' questions. We received a number of questions from, 4 questions from Councillor William Sapwell, and we've provided answers, and these have been published on the website. And I am just asking Councillor Sapwell whether he has any supplementary questions.
No, these are thorough and will answer the questions from my constituents. Thank you.
Brilliant, thank you. Yes, and I thought that the answers were, it was more than actually was asked. So yeah, I'm really pleased with the progress we're making, but it's good to monitor that. That's brilliant. And thank you to the officers for providing those answers. So we're moving on to the work programme, which is item 7, and I will again hand to Amanda.
Thank you, Chair. As this is the last meeting of the municipal year, I don't have any updates, but if you have any questions, you can take those.
So the work programme is on page 25. There are a few items. There are only very few items on there that you know, I've been put on, but we did have a meeting last week, cross-party, to look at the work programme from last year. And we also need to remember that the work programme is a working document, so it changes over the year depending on whether things get added from other committees and SNR, etc. Are members happy to approve this work programme for the next municipal year as is? Thank you. That's unanimous. So we can move on to item 8, which is the DAS report, I believe. This is on page 33 of your packs.
Thank you, Chair. So this report is my regular update to committee that talks through performance, delivery of the adult social care strategy, statutory assurance and our ongoing response to the CQC assessment that took place in September last year. In the last committee we talked quite extensively about the CQC outcome and the work necessary to move forwards. The last 2 months have seen a huge amount of work on our improvement plan, starting with extensive engagement with staff to get staff's views about the improvement necessary, moving now into a co-production phase with groups of people who use care and support carers and the well-established networks and partnership boards that exist in the city. We will be ready to put together the first draft of all of that feedback towards the end of April. We've mobilised and launched the service delivery layer of Future Sheffield. I appreciate that's probably the most technical sentence you'll hear in this committee today. For the purposes of clarity, that's the transformation work that this committee approved several months back. That's the single largest change programme for social care in the city, and a working group of this committee, as the Chair's just said, has drafted the work plan for next year. That will touch on every aspect of that programme, the evidence and impact that is expected on a committee-to-committee basis. And I want to thank the cross-party representatives who've helped shape the way that evidence will be presented to committee next year. In short, the service hasn't stood still. We are driving improvement at pace. There will be a great deal for me to report to the Care and Health Improvement Advisor at the end of June, when our first quarterly improvement update will be required, and that paper will also come to this committee. I want to acknowledge the context that we're operating in. Demand across adult social care remains high, and increasing complexity and acuity of care packages is an ongoing feature, particularly for our learning disability, autism, neurodivergence and mental health services. That pressure is felt both by the workforce, our partners and the public. And I want to particularly acknowledge staff in the ICB at the moment where radical decreases in capacity are taking place as we speak. The ICB has worked very clearly with us on those cross-cutting areas that will guide us into next year, such as the discharge grant, the Better Care Fund, disabled facilities grants, and some of the kind of responses in Councillor Satwell's query. Continuing to operate in those circumstances requires dedication and professionalism, and I think it's only fair to acknowledge the role of the ICB at this time. Despite all the challenges that we see, I think my microphone, no, there we go, we're all right. A strong understanding of where performance is already improving and a realistic grip where further focus and greater effort will be needed. Looking at strategy, our work with carers continues to develop. We touched on that last time at committee. We've improved assessment arrangements and stronger joint working with children's services. We're also seeing the impact of sustained investment in safeguarding partnerships, particularly with regards to self-neglect and hoarding. You will hear more about safeguarding in the annual report shortly. Our equality and inclusion work is increasingly embedded through training and everyday practice. And just to touch on the transfer of the carers service, I met with the Chief Executive of Rotherham Crossroads last Thursday and was really motivated by the energy, creativity and commitment to carers that organisation is already showing, having picked up the contract at the start of this year. On performance, and you have the detailed pack in the papers, the picture is mixed but moving in the right direction overall. So we're seeing an improvement in reviews with more people receiving long-term support, now having an up-to-date review, with particular progress in mental health, which this committee will recall is our single greatest challenge. Continued performance improvement in occupational therapy, which has a direct impact on people's independence. We're doing a lot of work with our internal workforce to make sure that mandatory training rates are improving, but I do want to acknowledge that we still have more to do on annual review. That's particularly important as we move forwards because that describes an individual's contribution to our improvement work, our transformation work and our quest for financial sustainability, so that will be a focus moving forwards. Waiting times for care, particularly domiciliary care, remains low. I think that demonstrates the huge impact effective commissioning and dedicated care provision can have for the city and is perhaps an example for other areas of complexity moving forwards. However, it's important to be clear and transparent where pressures remain. We have seen slight deterioration in assessment and review timescales, reflecting particularly seasonal demand and also the impact of recruitment restrictions. Safeguarding, screening, timeliness has dipped in the data that you have in front of you. I can report to committee that the most recent data set that was tabled after committee papers were published has addressed that and has improved significantly. Dole's backlogs are reducing, but they are still too high, and more detail will follow in the annual safeguarding update shortly. We're not complacent about any of this. We have mitigating actions in place, including operational plans, performance oversight, practice forums, system recording fixes, and continued working with the NHS partners on discharge and flow, not just for older people, but for mental health as well. Our response is deliberately focused, and we saw in the CQC inspection report too many strategies, not enough consistency, and variable understanding of what needed to be done. So moving forwards, there will be one coherent directorate improvement plan. That plan will align service plans, transformation activity, and the CQC improvement priorities I articulated at the start of this update. It's really important that that plan is co-produced with staff partners and people with lived experience, and it will be supported by clear measures of impact and regular reporting back to this committee. If there is a single feature of this plan that isn't readily comprehensible here, we will have got something wrong and we will need to rethink it. Finally, on governance and transparency, members will continue to receive consistent DAS updates, a clear performance dashboard in every meeting, and regular reporting on both improvement and transformation activity. That openness and accountability is central to how we drive improvement and has already been acknowledged by the Care Quality Commission as good practice, so we need to keep that going. In summary, the report shows a service under pressure but moving forwards with a clear grip on performance, an ambitious future and a strong commitment from our workforce and partners despite the multiple challenges we face. Finally, this is the last committee of the municipal year. I'd like to thank all of the committee members for the energy that you've brought and your commitment over the last 12 months. The committee's overseen a period of significant financial and performance challenge and has consistently done so with integrity, an eye for detail and a commitment to achieving the best for the people of Sheffield. I'd particularly like to thank Councillors Argencio, McLean and Crossthorne for their support and leadership, especially through the inspection process, and your ongoing encouragement and guidance to me as the statutory DAS. I'm asking the committee today to note the progress made, the areas we're prioritising and the approach we're taking to sustained improvement going forwards. And I welcome questions from the committee, Chair. Thank you.
Thank you, Matt. And, in return, we want to thank you. I'm sure everybody will agree, and all the staff and, at all levels for all the work that they've done over the municipal year, and particularly preparing for CQC and during the inspection. And yeah, it's a real pleasure to work with the team. Are there any questions? Councillor Sapwell.
Yeah, thank you ever so much. I'm really pleased to see young carers needs assessments highlighted in your report as well. That's a local and a national priority for us young carers. Good to see that the team's been brought in-house. Could you just give a brief overview as to the kind of resources behind that team and how many are in that team? Thanks.
I'll be honest, Councillor Sapwell, off the top of my head, I couldn't quote the FTE to you, but what I'll do is get you the structure of the team, the operating model, and some of the performance targets that they're working towards. I also think in terms of carers, given that we have work to do, it will be a focus for the committee next year, and we will make sure the annual report comes in. The key thing, having spoken to the Chief Exec at Crossroads last night and a number of carers in the city, the key challenge remains timeliness. There's still too many carers who receive the information they need too far into their caring pathway. That brings with it a huge amount of stress, pressure and sometimes isolation. So our work will very much be focused on broadening the range of support to carers across the city, trying to bring that time of intervention forwards, and making sure that where we have had feedback from carers, there's a clear response to that in the plan. Forgive me, off the top of my head, I don't know the details of that structure, but I will get a written answer for you.
Councillor McLean.
Thank you. Thanks for your report, Matt. I've got two questions. One just about the figures under the areas of risk section. So it was just the safeguarding screening in 2.39, which says it's at its lowest level since August 2024. It's only a small dip below the target, but I just wanted reassurance you're confident it's not going to continue on that trajectory. And then my second question is a more general question, that recently Baroness Casey gave a speech at the Nuffield Summit, sort of basically, I guess, sort of state of play where the Casey Commission has got to, sort of calling for this moment of reckoning for adult social care in our country. And I guess just hearing what she had to say, I just wondered what your reflections were based on, where we're at in Sheffield, and does it chime with where you think we need to go in Sheffield? So that was my question. Thank you.
Thank you. So on the first point, I think I can give assurance that the safeguarding performance has improved since the data was appended to the report, and I'll be happy to pick that up in our regular briefings, particularly in terms of not just screening but timescales for section 42, and that will be a key measure in terms of overall improvement. On the latter part, my reaction to Baroness Casey was one of joy, actually. I think it was the best articulation of the pressures that adult social care faces across the country I've heard in a very long time. Baroness Casey has been extremely thorough with the work of the Commission as her team. She spent most of her time out and about across the country exploring the issues. Some of the feedback that we provided in Sheffield was directly reflected as themes in that report. So I think she has caught the moment and given clarity in terms of the pace that we need, some of the legislative changes that we need to see. And I think we are very, very well placed to respond when all of that guidance come in. Since then, we've also hosted DHSC, who've sent a team up to talk about the challenges that paid carers face. We held a commissioning masterclass that Catherine led with a cross-section of civil servants as well. So there's huge interest in the city. We want to play our part in shaping the future. I've worked in adult social care now for approaching 27 years. We've had multiple commissions that all have attempted to grasp the wicked issues of long-term social care reform and brilliant legislation in terms of the Care Act, but never the means to make it happen. So I sincerely hope that some of the difficult decisions that Casey's articulated are considered at governmental level. and we are committed in Sheffield to do everything we can to support the work of that commission, because it looks increasingly powerful and increasingly clear. And I think I speak not just for the team in Sheffield, but for colleagues across ADAS nationally when we say that, and if anybody in this committee hasn't seen that speech, please do. It's extremely powerful, very clear, and a compelling mandate for change moving forward.
Thank you.
Councillor Milson.
Oops, sorry. Thank you, Chair. Thanks for the report. Just thinking about the improvement plan and service plans and the mention of co-production. And I do think that co-production is something that's higher up the priority list in adult social care than perhaps in one or two other areas of strategy and delivery in this council. I think it's noticeable that it's always there in reports. It's, you know, it's a common thread that you see in a lot of reports. But just to sort of check really what in your view, what does good look like in terms of co-production in this context? And do we have the resources we need to achieve that good scenario in your view?
Thanks, Councillor Milson. So I think in terms of what the CQC found was that there's no shortage of networks or opportunities to engage in the city. And indeed, we do have a number of very long-standing, deep-rooted boards that I'm sure you'll be aware of. I think what the team found was more of a challenge was demonstrating how that feedback impacted what we do. So that really clear correlation between you said and we did. Perhaps in some instances is because we haven't described what we've done well enough, or in other instances because we haven't been honest about the things that we can't do. And I think good co-production shows a clear thread in the process of design between the feedback we receive and the way we go about changing things in the medium to long term, alongside an ongoing conversation about the impact of that change. I don't think co-production is going in and giving the false expectation that absolutely everything can be changed. I think it is all about being held to account, being honest, articulating the challenges, but also being willing to hear. And I think some of the best instances of co-production are when staff go in and have those conversations with a genuinely open mind, which can sometimes be difficult to do when you've got the hurly-burly of day-to-day pressures, waiting lists, crisis scenarios, etc. But I think as the committee heard here last time when Faith was talking about the impact of her individual service fund and the flexibility it had given her, it's that kind of practical impact, giving people the ability to narrate their own lives, to have control of care and support, and being clear in the response to the questions and the challenges we receive. We're far from perfect. Very few councils are perfect. I do think there is a lot of work that goes on in the space of having those conversations, but I think we need to get better at the so what as a consequence.
Thanks, Matt. Councillor Dunn.
Yeah, thank you. Thank you for the report. As per usual, I'm going down to grassroots level because none of this means anything unless it makes change, you know, in our communities. Really welcome it, and I did see Baroness Casey, and I just wish she was leading everywhere because in my view, she just speaks really plainly. How are we going to make sure that this impacts straight, you know, right at the heart in our community? How are we going to see these great changes and the move in the right direction? How is that going to influence everything that the councillors in this room are able to do? Because so much about health and well-being is about what happens on your doorstep. It can make a significant impact, as we all know, especially loneliness, not being able to access things. So how are we going to make sure that we impact that and that helps direct funding in all the other areas of the council? Because that is the crux of it. You do your job really well up here, but it needs to be done right down there as well. Thank you.
Yes. Sort us out, Matt.
Yes. One of the things that I wasn't robustly interviewed about when I joined Sheffield was whether I did or didn't possess a magic wand, and I'm disappointed to inform the committee that I don't. However, I think the question is a very valid one. One of the things Sheffield does that not all councils do is the annual I statement survey that you might recall, and that is really about measuring personal impact. What difference has the support you've received made in terms of the outcomes you're trying to achieve? Hundreds of people participate in populating that for us, and that gives us an individual view of what difference care and support is making that's really valuable, as does the carers survey, as does the more structured and performance-based ASCOF survey that's a statutory requirement. And on top of that, of course, we have the work that Health Watch do in the city that articulates the view from grassroots level about whether services are working or not and what can be done to improve them. I think things like the Poverty Truth Commission's recent work describing the impact of the way that communication happens is a really powerful reminder of the need to keep things focused, clear, practical and empathetic. So in terms of how we measure, that's some of the ways by which we'll measure, but I think in terms of overall impact, if the transformation work and the improvement work delivers according to plan, what we will see is more people supported pre-Care Act than we do currently. What we'll see is a positive impact on timeliness in terms of our response. And what we will see is perhaps a little bit less replication and over-prescription on the far side of the Care Act line. So we will bring that picture here through the spotlight focus on the transformation work. We'll bring it through the performance report, but we'll also be looking to make sure that the voice of people with lived experience is heard and understood and reflected in what we do moving forwards. I don't think any of that ever gives you a complete picture, but it's a genuine commitment to understand and reflect that in the way that we operate moving forwards that will hopefully help improve things.
Thank you. I'm going to bring that to a close. Before that, I just want to repeat what I said in pre-meeting, just to make sure that the minutes reflect the fact that on page 42 there are two formatting errors in 237 and 241, where the numbers are repeated twice, but it should be different things. So it's where the number of people waiting for occupational therapy and the median number of day is the same number. So we need the correct version for the median days. So if that could be transferred to the minutes rather than change the report online, that would be great.
We'll do two things, Chair. We'll circulate that data in the interim, and we'll also make sure it's reflected in the minutes, and apologies for the pagination error.
It's okay. So we have 4 recommendations for this report. They are on page 34 and they are as follow. Ask the committee to note the progress in delivering upon the adult care strategy, living the life you want to live. Number 2, note the performance update and areas of prioritization and focus, including performance dashboard at Appendix A. Note the strategy delivery updates and achievements for this period. And number 4, note the progress of our improvement plan development in response to our CQC report and agree the proposed reporting schedule to committee. Are members happy to approve those recommendations? Okay, I think that's unanimous. Thank you very much. And we move on to item 9, which is the annual Principal Social Worker report, which is on page 61 of the report. If you could introduce yourselves for other people, please. Thank you.
Thank you. Dawn Bassender, Chief Social Work Officer and Principal Social Worker.
Oops, sorry. Jane McIntyre, Practice Development Manager.
So this report provides an overview of the work carried out by the Principal Social Worker over the last 12 months. So the report aims to demonstrate impact, not just activity. The report evidences how delivery is translating into improved practice. This includes strengthening supervision following template changes, increasing confidence in managing workloads, and a shift towards reflective and learning-focused audits. Audits findings are collated into organisational themes and fed back to managers, creating a clear learning loop between assurance and learning and improvement working. So work in 2026 will further strengthen the use of lived experience feedback alongside that audit intelligence. So in Appendix 2, you've got the Quality Matters framework. So how will you know that that is working and we're embedding it? So the Quality Matters framework will be the core practice and quality framework across adult care and wellbeing. It'll underpin the audits, reflective supervision and learning forums. So impact will be demonstrated through audit themes, increased consistency across teams and clearer reporting on how learning is identified, acted on and reviewed. So how will quality be assured? So audit activity has increased following a simplified proportionate approach that focuses on reflective discussions. So quality is assured through consistent tools, oversight of emerging themes and triangulation with complaints, safeguarding activity and supervision feedback. So the emphasis is on learning and improvement. So given the work pressures, how will we make it sustainable? So sustainability is addressed by embedding learning into everyday practice through supervision, peer support and strengthening manager capacity. Governance structures, network support and leadership responsibilities, building organisational resilience rather than just relying on individuals. In terms of training, the training development is aligned to the audit findings, complaints, learning and identified risks. So impact is reinforced through supervisions, practice forums and the audits, enabling managers to assess changes in day-to-day practice. Priority areas have been things such as strength-based practice, safeguarding leadership and legal literacy. We've also undertaken anti-racist practice training that's been delivered and the service is committed to social care workforce race equality standards. And further work in 2026 will strengthen the baseline data and outcome measures and the reporting to demonstrate progress beyond training activities. In terms of community deprivation of liberties, guidance has been a significant development that we've produced. We've now got a way of properly recording that on our liquid logic system, and staff are being trained in the legal safeguards and the requirement of the process to further improve in that area. So that strengthens the oversight and the support that people, for people with care arrangements that restrict their freedoms. In terms of preparing the workforce for legislative changes, there are some significant developments on the horizon, including the new Mental Health Act that came into force in December of last year. On the books is the Assisted Dying Bill, so I'm actively monitoring all legislative changes, and preparation will include ethical guidance, reflective discussions and practice leadership in supervisions and forums. So my aim is that the workforce will be ready and the risks will be reviewed as legislation progresses. Can't get my teeth in today, sorry. In terms of the next steps, are our priorities realistic and how will we track progress? So the priorities focus on embedding existing frameworks, strengthening that insurance and responding to workforce intelligence. We very much focus on, if the workforce tells us they need something, we respond and see how we can support. So progress will be tracked through the audit outcomes, workforce feedback and governance reporting to ensure that alignment with the statutory duties and service improvements.
Jane, are you going to add anything to that? Or?
No, I'm not adding anything to the actual report.
Brilliant. Are there any questions? questions on this report? It's very clear. So can I see how many people want to ask questions? So I've got Councillor Milsom.
Ooh, sorry, I keep doing that. Thank you very much for the report. I'm really interested in the role of social workers in connecting people to support opportunities, community resources, as that's all set out near the beginning of the report. So the way that social workers play that role in knowing what is available to people and prioritising things that are near to them in their own community, and that sort of signposting and steering to opportunities that are available to help people live a fuller life. So I just wonder, is it the case that all social workers are trained and briefed and equipped to do that really effectively? And in home care, has the new neighbourhood commissioning model led to any discernible kind of improvement in the way that care workers are able to do that signposting? So they're local knowledge, in other words. Because I think that was an ambition in moving to the neighbourhood model of home care commissioning, that there would be greater local knowledge amongst the workforce, and that sort of thing would become more streamlined. So just wondering if there's any early indications that that's working better.
Thank you. So we did develop a policy and further guidance around support planning. We introduced 7 steps that goes through and really supports staff and to really consider what's the person's assets, what's the community assets, is there any tech, so tech-enabled care that could support that person. I can't remember the full 7, but what we have done is Jane and her team have robustly delivered training around that. I don't know if you want to add to the training that we've done there.
Yes, the training on outcome-focused support planning was delivered to all social care staff as a mandatory sort of training package. And we are sort of beginning to audit to sort of see the impact of that training. And in particular, the use of assistive technology, which I know isn't quite the sort of the link with the community that you're talking about, but it's a key area that we're asking staff to focus on. I would add as well that there has been changes in the website. So there is more information available around sort of what's available in the local community. So staff obviously do have access to that, and they also have access to, I think, Sheffield Direct, which has got a good range of community resources.
Thank you for that.
Sorry, just the second part of your question is Sheffield Directory, sorry. In relation to the second part of your question, in terms of that move to the neighbourhoods, I'm not able to answer that fully. I'm sure Catherine will be able to answer that a little bit more in her commissioning report. But in terms of the feedback that we're getting, it does seem to have had some improvements. But the further details I'd have to either get back to you or Catherine may address it in her commissioning report. Is that okay?
Thank you. Just following on from there, because I think the first part of Councillor Milsom was about how much do social workers know about the small community organisations that deliver services in individual areas, and how much they can recommend. And I think, was it last year that we had like a fair here where it was a social worker fair, and it was incredible because there were lots of really small organisations and they were all really pleased to be there because they felt their social workers were actually getting to know them a bit better. And sometimes it's about what the social worker know and what's available, and there might be different things. So it's about keeping updated. I suppose if they have access to that information, that's great, and if it can be updated. I have just a couple of questions myself. One is on page 67, and it's about having the ongoing work with the Carers Centre to ensure that carers' assessments are uploaded to Liquid Logic, and I was wondering how we're progressing on that. And then on page 72, I was just wondering what are we putting in place in terms of monitoring. Obviously, it's brilliant to know that there is all this training and, you know, all the supervision and how important, and in fact how, you know, they are mandatory and that support social workers. But how do we balance that? We keeping an eye on their workload in terms of how they're managing with their caseload and how they are managing to keep track of all the training that they need to do, and whether there is a system to ensure that people don't burn out.
Thank you. Yeah, as Matt mentioned, the novation of the care and support contract went really well. We are working with the new Crossroads, with the new providers, around looking at the carers assessment and redeveloping that. And then the goal is absolutely to get that onto Liquid Logic, so that you know, we would then be able to the workforce can see the carers assessment, and we can work in a greater joined up way. So that is absolutely on the work plan for the next 12 months. Not there yet, more work to do, but it's definitely there. We're all in agreement that that's the best way forward. In relation to the caseload, we have introduced in February 2025 a caseload weighting tool and guidance, and that looks at case prioritisation, and the tool helps balance workloads fairly by recognising that some cases are more complex and time intensive, and supports that staff wellbeing, so that we can actually, you know, properly monitor, not just in numeric terms, but looking at where things take more time. So together those tools ensure that timely decisions and consistency in practice and safe services. But in the actual numbers, so the average in adult future options for just casework, safeguarding is counted separately, is for a full-time worker there's an average of 11, in living and ageing well there's an average of 9, mental health an average of 10, and first contact an average of 9. So when you add safeguarding work, the overall average across the service is 12 to 15 for a full-time worker. There is no national benchmarking. That doesn't exist, unfortunately. So I'm not able to benchmark it because unfortunately it doesn't exist. But we do monitor it both numerically and, like I say, because the numbers aren't just the thing, it is about the depth of work that's required with a particular person. So we're not just comparing numerically, we are looking at that as well.
Thank you. That sounds, you know, reasonable, and I know that numbers don't tell the whole story, it's the complexity, isn't it? That is the story. I'm going to allow Councillor Milson to come back in, but just very briefly.
Thank you, Chair. I mean, I could have asked all the questions in the first place. I'll just squeeze this in. Just on page 66, just a little bit about the unpaid carers, profile of unpaid carers. Practitioners to follow through on referrals to Carers Centre is a sentence that slightly stuck out. I'm just wondering what's not right at present that needs putting right there. It's identified as something that needs improvement. Just wondering what's amiss at the moment. And I just wanted to highlight the turnover, the staff turnover figures, which I think look outstanding to me. It's a shame we can't get a CQC rating just for that, because I'm sure that would be outstanding. Incredibly low turnover figures, and it's something we've talked about a lot over the last few years, isn't it? Changing strategy with workforce training and the Care Academy, and valuing our care professionals more, and that indicates to me that something's working really well. So I'm sure you know what we're doing right, and there isn't time to delve into it, but how do we ensure that we keep doing it right? Because those figures are really good compared to national 1 to 2% turnover compared to 12.8% nationally. I think that's a success for Sheffield.
Said quick.
Yeah. But in the grand scheme, it's quick.
So yeah, there was a slight error on the Liquid Logic system where we made a change, and there was a slight error where they weren't quite getting to the carer centre. We picked that up quite quickly, we rectified that. But what we wanted to say is going forward, we shouldn't just rely on the system, we should ensure that that we're checking. And one of the ways that we will then change that practice and ensure that that is more consistent and the way that we're checking is by both recording on the same system. So those errors will be picked up even quicker and adjusted even quicker. And yes, I was rather pleased with the retention rates.
Thank you. So I'll bring that to a close. The recommendations are on page 63 of the pack. There are 5. So we are asked to note the annual Principal Social Worker report, including achievements over the past year and areas requiring continued focus and support publication. Endorse the next step set out in the report, including improvements to practice standards, supervision, staff development and safeguarding activity. Number 3, seek further assurance in relation to the development and monitoring of community deprivation of liberty, CDOL. Number 4, note the introduction of the adult care and wellbeing practice quality standards and consider how evidence of progress should be shared with committee. And number 5, request a further update in 12 months, including workforce insight, results of quality assurance activity, and progress against the improvement actions, including performance data and wider evidence of progress. Are members happy to approve those recommendations? Yeah, please do.
Just quickly ask about number 4. So we're recommending to ourselves to consider something, but it doesn't say how we will consider it or when we will consider it.
Do you want to?
Could I also just point out an important typo?
Yeah, please
I
do.
think it's in 2.2. It says anti-racist training rather than anti-racist. Now, wouldn't normally point that out, but given that the section after it is about sexual exploitation, I think that's quite important we correct that.
2.2. Sorry. Oh, I wish my eyes was that good.
Sorry, I've lost it myself
What
now.
page is it?
It's right at the beginning of the report.
Chair, we've got to go back through the papers for accuracy anyway, so we'll pick
Yeah,
up and
thanks.
sort that out.
Thank you. Sherry, do you want to look at the point made by Councillor Milson about 4?
I'm going to say something. I didn't actually check the reports this month. It was done by another officer, so this is actually quite new to me, this recommendation here. I presume what was just saying there is note the introduction of this quality standard, which obviously you're noting, and then the second bit is and consider how evidence, which obviously you can't consider, can you? So I think we could make an amendment to that, if everybody's in agreement with that.
Yeah. What amendment
I know. So note the introduction of and well, you could just take it and consider out, couldn't you? And how the evidence, because that'll be form part of it. Sorry, or we could take all of that. I mean, it's just really practically how's that going to be? Yeah, no, I agree. Yeah. I'm completely in agreement.
Shall we just take that sentence out?
Shall we just take that
and
out?
then we can discuss how we present it next time.
Yeah.
Is that okay?
Yeah.
If we take that sentence from and out.
Yeah.
Of the recommendation, and then we decide how we want that to be done in briefing. Yeah, consider in briefing how evidence. Yeah. So can we add after the word consider in briefing, briefings, how evidence of progress should be shared with committee? Thank you for pointing that out.
Thank you.
Members happy to, so can someone propose that, can someone propose that amendment and someone, thank you. Are members happy to approve those recommendations as amended? Yeah, and we will pick up the typo in the redrafting. Thank you, Councillor Sapwell. Great, so we're moving on to item 10. Thank you. which is the Safeguarding Adults Annual Update. So if you can introduce yourselves to the committee when you start the report, please. Thank you.
Good morning. Andrew Drummond, Service Manager for Safeguarding Quality Assurance in Adult Care and Wellbeing.
Good morning, my name's Cheryl Oldfield and I'm the Sheffield Adult Safeguarding Partnership Board Manager.
There we go. So I'm bringing today the Safeguarding Adults Annual Update for 2025, in which it evidences strong statutory performance, shows significant safeguarding activity across that period, and quite strongly over 90% of cases saw risk removed or reduced. In 92% of those safeguarding episodes, people's outcomes were fully or partially met. The report highlights the strength and assurance function in the service, improving monitoring of long-term open cases with targeted escalation to reduce delays and manage risk. Further enhanced training for managers, which had been a point in our delivery plan previously, and continued embedding internal training for practitioners. Together, the delivery plan and the annual update demonstrate a coordinated, evidence-led approach to safeguarding improvement, providing assurance that in Sheffield we're meeting our Care Act duties while continuous learning and system development. The delivery plan itself, which is included as an appendix item, sets out our vision that adults with care and support needs live safely, free from abuse and neglect. We've got an emphasis on making safeguarding personal, strong multi-agency working, clear governance. It outlines progress made in the last couple of years, such as strengthened quality assurance, the improved advocacy provision, expanded training, development of the adult MASH, improved oversight of provider quality, including organisational safeguarding work that's been ongoing and improved over the last couple of years, alongside the partnership working. Key highlights include the further embedding of the self-neglect policy and practice guidance, and making sure from an assurance point of view the method of recording that work is built into Liquid Logic, ensuring that key services across the city continue in collaboration with the safeguarding board, such as key hoarding services, where we have seen particular themes around self-neglect as a main category of abuse or neglect. And further, the adult LADO role, so the adult local authority designated officer, for where there is sources of abuse or neglect in positions of trust. That role manages those concerns to make sure there's ongoing work around developing expertise in that role and making sure that people across the city with care and support needs are kept safe.
I'd just like to add to what Andrew's just said. From a board perspective, obviously we provide oversight. We've got our strategic plan for 24-27 and our strategic delivery plan that underpins that strategy. I've heard a number of questions and a number of examples of carers, and we've got a carers task and finish group within the board under our structure. We've also been reviewing the structure to make sure that we can deliver effectively and be compliant on our 5 strategic priorities that were co-produced with our customer forum. I think something that jumps out from a carer's perspective is that when we are doing our safeguarding adults reviews, not all carers want to be carers, and not all carers are adequately equipped to be carers and need care themselves. So hence, where we've looked at the task and finish group, I think there's a real key risk for carers if they're not supported effectively and adequately. I think something that we're keen to do from a board perspective is have a real front foot, proactive prevention focus. I think historically there's been, because of demand, there's been a lot of reactive behaviours, and I think now we need to be more proactive and on the front foot. And I think that's, you know, something that we've done when we've reviewed our policies and looked at our training package and our training strategy. But I think as well, you know, Andrew's just mentioned the Alado post. The board are funding a lot of initiatives, so they're funding the Alado post. They've just recently funded the Magpies project to look at a key priority for the board is self-neglect. So we've got a self-neglect project running at the moment that's chaired by Kitty Riley, who's the designated safeguarding professional for the ICB. So we have got that ongoing self-neglect project at the moment. We also fund projects in the community for Not Born Yesterday, which is the trading standards project to protect vulnerable people against exploitation and fraud. We've also got we fund the community training post, and we fund the Safe Places project, which is the Healy City Farm project. So we've got lots of initiatives going as well. But I think just echoing what's been discussed this morning, we are looking more at using and utilising community assets. We know that there's a lot of knowledge and a lot of activity happening in communities. There's the likes, you know, the local area committees, the local area committee managers. There's a lot of really good, effective work happening that adult social care and the board overseeing that needs to tap into, because they're the eyes and the ears of the people that are vulnerable in our communities. And I think that that's something that I want to focus on through the strategic delivery plan from the board as board manager with partners to kind of have that golden thread and join all those dots that's happening in the communities. Just basically echoing what's happened with the adult social care report from the CQC. I think there's real emphasis on not just looking at statistics, but actually speaking to the individuals and making sure that the partners and service users are engaged and are getting that feedback, and, you know, making sure that statistics are great, but if, like we've talked about this morning, if that's not replicated in practice and people aren't seeing those results, that's where we need to improve. I think that's where the improvement lies.
Did you want to add anything?
No, I'm open to taking questions and respond as appropriate.
Thank you. Are there any questions? I've got Councillor McLean and Councillor Sapwell. Can I take both questions, and then is that okay if I take both and then you can answer?
Thank you. Thanks for this report. Just a couple of questions. The first one was about the increase. Can you just come back? Okay. Sorry. The first one was about the increase in concerns from 2024 to 2025. That it's gone up quite a lot, and obviously it's good that those concerns are coming forward. But what's sort of fueling that? And is there anything that we need to consider there? And then the other question was just out of interest. On page 200 of our pack in 24 of your report, it talks about how the data shows that 60.4% of safeguarding episodes were where the female was the adult at risk, and how this is, for us, is stable and not a new trend. But I just wondered how that sort of fits with the national picture. Is that sort of common sort of trend nationally? If that makes sense. Thank you.
I'll take Councillor Sapwell's as well.
This might not be the section to ask it in, but Ms Boucher was talking earlier about dolls and our performance on those. So just looking for an update on that, and excuse me if this isn't the right section for that, but thank you.
Okay, so firstly, in regards to the concerns, our mass service manager has done a lot where, as a team, we've analysed where the concerns are coming from. The police have been one of the highest, when it comes to organisations, one of the highest referrers. And we've done work with the police in looking at the type of concerns that are received, because there's a lot of them that don't necessarily progress to inquiries past the first concern. So into the future, we might see that some of those potential numbers go down in relation to that, but likewise there's other themes, as I say, around self-neglect being a big theme, and the work that's going on in collaboration with the board and other partners to look deeper at that, and how we can work with people from ground level, like, for example, with the Magpies project. They've got user groups, for example, and trying to get more people involved in that and have peer support where appropriate. So I think it's not one single response, but a combination of looking what the themes are looking which the highest group of referrers are and working with them to help them understand what is appropriate as a safeguarding concern, and where at times it might be that it needs to be referred to, a concern might need to be referred to somebody's GP or mental health services, because some of the concerns that we do receive aren't necessarily about abuse or neglect. It may be about a person's care and support needs, and then some of those are closed down quite early, but that could at the same time delay the person getting the support that they need. So it's about working with partners to help them understand the right pathways, so to speak, and getting people to the services that they need to at the earliest point. And that work remains ongoing, and we'll be monitoring through this year about how the numbers are. In regards to 60%, like I say, being female and that being a continued theme, we have done a bit where we've looked nationally before, and I think that is a common picture, but we need to look at more recent data. I know when I looked at most recent data wasn't necessarily up to date with the 2025 in the statutory annual returns that are seen across the country, but need to look at that again, and we can look at that. And when the board do their annual report as well, they do in certain areas looking at some of the national data, and we can see what comes out of that for that theme, see if there's anything. On the DOLS data, we bring regular updates to our directorate leadership team, but I apologise, there's not the information in the safeguarding update, and we can speak to Matt to see at what point we bring that to committee in the future.
I think Matt is coming in. Thanks. Matt.
Yeah, thank you. I'll cover both those points off. So the latest safeguarding adults collection data nationally, this is the NHS digital source, records 60 to 62% of individuals involved in Section 42 inquiries are female. So we're bang on the button in terms of comparison. In terms of the latest position on DOLS, our February data was 1,340 people waiting for assessment or annual renewal. That's an improvement from January. Worth noting that as time progresses, we're going to see a higher proportion of those numbers being renewals, so that people are already in the system who've already had the assessment but have now tipped over the 12 months required for the position to be revisited. So that's where we're at right now.
I have 3 more members who've indicated. I'll take all 3. Can you be as brief as possible, please? Councillor Lee.
Thank you. Just on the topic of self-neglect, it seems to me it's quite a complex sort of area and condition, and there might be self-neglect because of loss of capacity over time, and that might mean that we're not aware of that problem. You know, it might be, you know, we've just not come, it's just not emerged as no one's picking up in the community. But also then there's self-neglect because of negative behaviours, which is sometimes picked up in the community because of the issues it causes for neighbours and the police. You mentioned the police and other issues. How do we approach both? I mean, we've got to, sometimes we won't know, we won't be aware that somebody's experiencing self-neglect because it's just not come to the attention of anybody. But the other issue is about because of negative behaviour, somebody's maybe alcohol abuse, it may be mental illness, it might be a complex situation where all those things are involved. How do we get involved, and how prolonged is our interventions in those sort of cases?
I'll take the other 2 because, so Councillor Milson.
Thank you. I just wanted to ask a bit further about that that gender, adult safeguarding episodes by gender, that rather alarming split, and whether we really know what factors lie behind that asymmetric split between male and female, in terms of, you know, what is actually behind the reason for inquiring about the incidents. Are there common factors that mean that more females are involved?
Councillor Dunn. Councillor Lee, could you switch your microphone off, please?
Yeah, thank you. I would like to know, how do we make sure when somebody interacts with for instance, an emergency service, often they aren't aware of the safeguarding, do you know? So what checks and balances are in place that when somebody does interact with that, maybe they've had an accident for instance, just so that those people are protected while protecting their, you know, kind of their GDPR. Because to me, when that happens, that can often trigger something. So, yeah.
Okay, so firstly, with regards to self-neglect and how we support, the Safeguarding Board has a local self-neglect policy and practice guidance, which has been in place for, I'd have to double check the exact date, but a number of years now. And part of the work that the self-neglect working group is doing, which is made up of partners from across the Safeguarding Partnership, is looking at that policy and looking at the challenges that we've seen over the past few years, which have been common themes in safeguarding adult reviews. And as you referred to, there's often no one single reason. It might be, where you mentioned about alcohol, we've seen hoarding, drug substance misuse, and we have picked apart some of those issues in the past few years. So the report mentions about an example being where we've worked with housing services, and we've got in place a rough sleeping social worker. Working with the board, we've got continued funding for the Magpies project, which supports people with hoarding. Our alcohol service that supports people is commissioned to likewise. But I think essentially it's about partnership working, one of the key themes from making safeguarding personal. And that's one of the things that we continue to push with staff in training. It's not for one single agency alone. Safeguarding is everybody's business. And it continues to be, I think, a challenge for all statutory agencies. That, as I say, could be for many reasons and often linked to trauma that somebody's had in their life from times an early age. And that can take developing a trusting relationship with somebody, whether it's from ourselves, from the NHS, to support, as I say, where Matt mentioned previously about complexity of cases at times. And I think it's worth acknowledging it remains an ongoing challenge, but there's a lot of expertise across the city in working together to try and support people as best as possible, I would say, around self-neglect.
Thank you. I think Matt wants to come in on this point.
Sorry, Chair. I was just going to come in on Councillor Milsom's question about gender, which I think is a highly relevant line of inquiry given the nature of the demand that we're seeing. So what we know in Sheffield is men are disproportionately represented in areas like self-neglect, substance misuse, homelessness, antisocial behaviour, hoarding and environmental risk. Women are more likely, statistically, to feature in domestic abuse, coercive control, financial abuse, abuse by family members or partners. But there's also demographic factors here. So we know older women live longer. We know they're more likely to be in supported living or in care homes. We know they're more likely to be known to services earlier in the pathway, whereas quite often, from a safeguarding perspective, men, particularly mid to later life, are more likely to live alone, not in that kind of care setting type environment, and they're often unknown to services until the risk begins to escalate or the crisis is right on top of us. So all of that leads to later presentation on the part of males, higher acuity, and a greater likelihood of concerns then going on to section 42. So it's a combination of the different experiences of abuse and the demographic factors that I think accounts for the difference between the two genders. I've got a bit more detail about that I'll share with committee as well.
Thank you. I'll move on to point 6 around emergency services from Councillor Dunn. On that one, and say emergency services that spring to mind, being police, ambulance service, hospital, fire service, and we do work with all of those agencies. All of those are partners within the Sheffield Adult Safeguarding Partnership Board. Particularly, for example, when it comes to the fire service, our staff as a mandatory measure attend training from the fire service on an annual basis about referring customers to the fire service, for example, for fitting smoke alarms and talking about fire safety in the home. And that remains an ongoing priority, as we've seen in some safeguarding adult reviews. That has been a factor where a person has died, unfortunately. When it comes to Yorkshire Ambulance Service, as I say, they remain an ongoing partner within the Safeguarding Board. We see a number of referrals from them. We continue to work with them. I attended a meeting with the ambulance service and care home managers talking about appropriate safeguarding referrals and that relationship between care homes and the ambulance service. And I say with the police, there's ongoing work around recognising what is an appropriate safeguarding referral and when to refer to other services. So I think, as I say, it's a continued working relationship with each of those partners and supporting each other to understand where our duties apply and equally where we need information from them. I suppose drifting back to self-neglect at times, as much as we have accountability when it comes to safeguarding them, other agencies play an absolute key part and at times maybe need to be the lead in certain enquiries.
Thank you. I'm going to bring that to a close. And just so to remind people that we are represented on the Sheffield Adult Safeguarding Partnership Board, because both myself and Matt sit on that. So we have a meeting on Friday, actually. So if there are any questions that you have about that particular board, just please ask me on that. The recommendations for this report are on page 109. There are 4. I have just a bit of a change for number 4, but I will mention it as it is. So we are recommended to approve the proposed actions set out in Safeguarding Delivery Plan 2025 to 2027. Number 2, note the assurance, the action completed on, and to note upon confirmation of the 2027 Section 11 audit. New action will be added to the Safeguarding Delivery Plan. Number 3, note the performance update for the whole of 2025. And number 4, I'm just going to ask for the abbreviation to be spelt in full, because in 2 years' time nobody will remember, the layperson, what that means. So note that rather than SASB, the Sheffield Adult Safeguarding Partnership Board Annual Report. Are people happy? I propose that change to the recommendation. Can someone second me, please? Yeah, thank you. Are people happy to approve? And sorry, I didn't notice the abbreviation in the pre-meeting bit. But yeah, we should not use abbreviations in recommendations, I don't think. Thank you. Thank you very much. So we move on to item 11, which is on page 217 of the pack. And this is the adult market and commissioning update. And Catherine is presenting.
There we go. Hello, good morning. My name is Catherine Bunting and I'm the Director of Quality Strategy and Partnerships for Adult Social Care, including commissioning. So this report is more forward-looking than previous commissioning updates that have been brought to committee, and it presents to committee the key improvement priorities across all of commissioning and market oversight following our recent CQC inspection. And these are reflected in our draft commissioning intentions and our for 26-27 and our draft improvement plan for commissioning, and they're in Appendix 1 and 2. Both of these documents form part of the Directorate's Transformation and Improvement Planning that was covered in the DAS report. And as Matt said, we're undertaking engagement and co-production to finalise those documents within the next couple of months. There are 3 updates in the report for committee provided relating to previously approved commissioning strategies. One is around community equipment, particularly noting the potential for 3 areas in the region to come together to co-commission community equipment, whereas before Christmas when we came to commissioning we thought that might be 2. For community dementia support, which is the current contracts are coming to an end, so we would be moving forward against the dementia strategy and commissioning plan to seek continuation of that model. And then finally for planned respite and emergency beds in residential settings, and that procurement is going to seek to rebalance some of the beds we've got where we have underutilisation of planned respite and more pressures in emergency, so making that a more holistic offer to improve access and experience for people and provide a more value for money and efficient model. The report notes the overall quality of the market and informs the committee that we've had 5 embargoes in the last 12 months for providers, not providers. What we mean by embargo is where we place restrictions on admissions or the picking up of packages of care until the provider can demonstrate improvements have been delivered and are sustained. And sometimes that might be a full embargo where we just hold all packages. It's almost always done in partnership and in agreement with the providers, and sometimes it's lighter restrictions where we make sure that before accepting anything they talk to our quality assurance team and we check that package of care can be delivered brilliantly and safely. And then finally, the report recommends that committee notes the proposals for 26-27 fee setting. There have been some formatting issues in the report. So at the beginning of the report, it says that that's at paragraph 4.5, but it's not. It's at 3.7. Thank you very much.
Any questions? Councillor.
Thank you for this report. A couple of questions. The first one is on page 229. You talk a little bit about how in 26-27 that the team's going to be working with our providers to plan and prepare for the fair pay agreement, and I just wondered if you could share a little bit more about what that might look like in practice. And then on page, well, more to do with carer service contract, because I understand that comes to an end in December 26, so work will be beginning to sort of look at how that service is going to be commissioned. I just wondered if you could talk a bit about what that's going to look like and the timescale for that, and how lived experience is going to be taken into consideration with what that service looks like going into 27. Thank you. The carer service. Sorry, thank you.
Yeah, okay, so the fair pay agreement and engaging with providers to understand the impacts of that. So I think that what has happened recently in the last few months, which is brilliant for Sheffield, is that the Sheffield Care and Support Association has refreshed and reinvigorated itself. So we've now got a provider association in Sheffield that covers the whole of the market, and it provides us a really strong partnership vehicle really to help us with our transformation delivery, shaping the market, working with the market and getting that two-way communications. So I think what we really want to do is work with them to be able to make sure that we talk to as many providers in Sheffield as we can about the impacts of that, both providers that we contract with and who focus more solely on the private fee market, to make sure that we address our entire duty for sustainability. I think we want to be understanding current pay rates for staff, what the gaps might look like, where the pressures might be. And we do get, like with all of our fee negotiation conversations, a regular theme that comes back from providers is that ambition to pay foundation living wage and have that retention for staff. So lots of that conversation will be picked up there too. I think we will also be running that alongside fee setting processes and the use of Care Cubed, which we use to understand the cost of care for different types of provision and making sure that that's sustainable. So those two things will run in parallel. In terms of the new carers service and co-production, we've started with a really positive relationship with Crossroads, and Lee Teasdale-Smith, who was here at the last committee to talk about the carers plan, has both engagement forums for adults and with children's, where he speaks to unpaid carers, providers, and runs a series of events, including a sort of partnership forum to feed all of that through. So there'll be, again, the sort of groups of people and the mechanisms by which we try to make sure that the new service responds to both our improvement priorities, the resources that we've got available and the needs that we need to meet in a way that works for unpaid carers in Sheffield.
Any other questions? Okay. We have recommendations on page 218. 6 recommendations. So note the priority improvement areas and draft improvement plan relevant to commissioning fall on the CQC assessment outcome. We're also asked to inform draft commissioning intention and implement priorities for 26-27 and request progress is reported to committee in future commissioning updates. Note the development of the procurement and community equipment and set out in paragraph 211 and 213. Note the intention to tender for the community dementia support provision in 26-27 and to delegate the approval of the procurement strategy to the Executive Director of Adult Care and Wellbeing, the DAS. Note the intention to tender for planned respite and emergency residential placement in 26-27 and delegate the approval of the procurement strategy to the Executive Director of Adult Care and Wellbeing, the DAS. And note the proposal for 26-27 fee setting as set out in paragraph. Can we amend this for the minutes? It's not 4.5, it's 3.7, as Catherine pointed out. Are members happy to agree those recommendations? Thank you. Thanks, Catherine, for presenting. And we move on now to item 12, which is the Adult Care and Wellbeing Complaints Annual Report. And we have Andrew and Dawn presenting. The report is on page 309.
Okay, thank you. So we bring in the annual report for complaints. It provides assurance to committee on how adult care and wellbeing is managed, responded to, learned from complaints in 24-25. Most complaints fell under themes of failure or refusal, staff conduct and policy, with no complaints logged under delay, reflecting efficient response times. Only 3 complaints related to quality or equality, showing strong practice, although a significant drop from previous years will be monitored. A significant theme of the complaints, the staff conduct area, when we've looked deeper at this, I think we feel this relates to the large-scale recommissioning when it came to home care for people aged over 65. That reduced providers from 35 to 14 organisations. That introduced both continuity challenges and service benefits, but where them complaints were received, immediate action was taken in a personal way with each of those. There's some examples in the report. The service improved its average complaints response time by 9 days, strengthened guidance for appeals, and is developing clearer customer communication regarding escalation routes to the Ombudsman. Compliments remain an important learning source, and we've logged 33 in that period, and we want to make sure that was reflected from a previous ask from committee. Escalations to the local government ombudsman increased from 14 to 22, though only 4 were upheld, suggesting firmer and more consistent application of statutory duties. Overall, the report evidences strong leadership, a commitment to learning from feedback, transparent governance, and alignment with the council plan outcomes, safeguarding duties, and our Care Act 2014 statutory responsibilities.
And just further in relation to positive comments coming through, Living and Ageing Well are sending out postcards to people who draw on care and support. This has had a great response, lots more compliments coming through. We're really encouraging that they're formally recorded to better represent in the next year's report the positive work that's done. So we're also obviously encouraging other teams to follow this good practice.
Any questions? Wow. I already kind of pointed out on page 323 there's an error in the formatting. Is we said we would change the second paragraph. It's not care homes, it's home care. Yeah, it just when we do that, it's just one of those where the words are being inverted, just for completeness. I just wanted to make a point about compliments, and I think you know, obviously in the big scheme, notwithstanding, you know, the fact that people have a, you know, a very good reason to complain about when things are going wrong, I think we need to be better at also having a conflict, because they're good for staff. Because when you do a good job day in, day out, and nobody says anything, but then you get a complaint, it's demoralising. So I think it's really important that we kind of encourage that. And I know we're getting better. And also like those I statements that we were talking before, if we can like triangulate things so that when people, you know, give us statements and they have positive things, if we can use them as positive, you know, with asking them, obviously, I think it's, you know, it's a way to also kind of take into account what good job people do every day supporting vulnerable people in the city. You know, I think we take it for granted because people are so professional and so passionate about what they do, but it's actually not to be taken for granted, because it's amazing what people do every day. Notwithstanding the fact that sometimes things go wrong because the numbers that we support are huge and we cannot be perfect. Perfection in this area doesn't exist. It's a learning curve all the time, isn't it?
Yeah, absolutely, thank you. And like I say, learning curve, we take all feedback really seriously and respond as necessary. And I think particularly when it comes to compliments, I think previously we've not necessarily had as robust data, and I think where 33 is an improvement where we've not necessarily been able to put that data in before. We still want to see a lot more, because I don't think 33 reflects the positive message that staff get on a daily basis from people that they work with. Like Dawn said, I know in Living and Ageing Well, they are trying to look at ways in which, where it's easier for people to document their experience. For a lot of people, logging onto the website and going via the route that we have on there, it's not necessarily always been very clear, we've felt, for people how to give feedback of a positive nature, and looking at things like giving people a postcard that they can return or giving people a QR code is some good practice that some teams have been doing, which we want to replicate across the whole service, so we get a more full, holistic picture of the experience that people are having with the service.
I mean, that could apply to anybody who works in the public sector, you know, not just people who work in the care sector. I have Councillor Dunn and Councillor Gilligan-Cooper.
Yeah, thank you. Page 329. I'm really interested in this, the fact that you are doing like a social work trainee apprentice, you know, and it's transferable skills. How are we actually analysing the data on how successful that is? Because I think it's really important, and I think recognising those skills, but also is that, you know, linking in with the mental health support that we're giving our staff as well, which I really commend and thank you for. But while transferable skills, this is a really specialised area and it might not be for everyone. So it's actually making sure if someone realises that isn't for them, that it isn't a failure, it's because doing that role is not easy. So it's what support, if you could just highlight that, you know, very briefly, or kind of send that to the committee, I would find that really interesting. Thank you.
Thank you. So yeah, with regards to the apprenticeship programme, I think like it mentions there and goes into a little bit of a detail. Dawn may want to add a little bit more, but I think it's a real strength within the service where we're recruiting from our own staff within the council. And that's not just necessarily within adult care and wellbeing, because we recognise, so there's colleagues in, for example, children's services or housing that have got transferable skills where it comes to looking at people's strengths. And then through that programme, through the apprenticeship, we've been able to support them to develop their knowledge around particular hugely important legislation relevant to our work. And in that as well, getting key day-to-day experience, shadowing qualified staff, and through that being in their placement period alongside formal qualification in that as well. I'll hand over to Dawn to add more on that as well.
Yeah, the social work apprenticeship is always really, really, really popular. We get lots and lots of people applying for it because people, as our previous retention rates in social work show, people want to stay and work in Sheffield, so it really does give people that opportunity to learn and grow and develop while still working in Sheffield. And that is one of the many reasons why we've got that retention rate as well, because we've got that ability to be able to offer people that growth within the service. And yeah, we when we opened it out, because it used to be just internal to adult care and wellbeing that we offered those apprenticeships, but opening it out across the service has gained so much in terms of different knowledge, different skill sets, and it's bringing such greater depth to our workforce that we really, really appreciate.
One very quick follow up on that, if I can. We've got a fantastic diverse city. How is our recruitment reflecting that? Because it will be more successful if the apprenticeships and the people that are doing that are very relatable to the people that need support.
Can I respond to that? I suggest that you read the equality report that is going to SNR this afternoon. That has got a really in-depth kind of the whole council in terms of across all the... I'm in that meeting this afternoon, so I've got it really... So it's on today, so it's on the website, so that there are answers to that question. There's a really deep analysis of our workforce, and that will kind of... So, Councillor Gilligan.
Yes, thank you. It's a very comprehensive report, and there's just one little area I don't understand, so I'm just really asking for some clarity. It's on page 323. And it's talking about hospital out of hours, localities, etc. And we do seem to have quite a number of complaints there, and I don't really understand what that means and what the relationship is to the hospital. And is that meaning the services we offer out of the normal 9 to 5? I'm just not quite sure what that paragraph is, or that block is about.
It's the table on page 323 at the bottom. So it's where it says hospital out of hour, living and aging well, long-term support. And obviously it's changed because it used to be split in lots of different things, and now it's all grouped together.
I was just curious about what kind of services is that? Is that our services that are outside of 9 to 5, or what are they? Because I don't really understand that bit.
Yeah, so a hospital, an out-of-hours service. The out-of-hours is the social work service that is supporting people and answering the phones outside of them hours, and at times it might be putting in a contingency type response. The hospital services is the service where somebody's been in hospital for a period and then we're supporting them home, often looking at doing that initial assessment, and then it might be putting a reablement service, a short-term service, or that short-term service might transfer onto a longer-term domiciliary care provision at home. And that in that same figure as well across hospital out of hours is the locality teams, where it says living and ageing well, long-term support. So that's a whole of the services that support people who are over 65.
So then, are there's quite a large number there, it's 48 in total. Is that just that there are delays in these services? Or?
Okay, so that 48, we mentioned earlier when we were digging deeper into that, we were trying to pull out what that may relate to. The period in which this report is from is where we had a significant commissioning change. So we reduced the number of domiciliary care agencies we have significantly, and that had a lot of positives, but whilst we appreciate at the same time as well if a person had a care agency for a long period and then that was changing to a new agency, there were staff who were getting to know that person's needs, and we'd like to see when we bring this to committee next time that has reduced or stabilised, well, reduced, we'd like to see. So, as I say, we went under a significant period of change in that area then, and yeah, we feel that's the reason.
Thank you. I'm bringing that to a close. Matt, did you want to come in? Did I? Okay, sorry, because I wasn't really looking your way. So there is only one recommendation on this report. It's on page 311, and it says The recommendation is to seek endorsement of the Adult Social Care Complaint Annual Report 2024-25. Are members happy to approve the recommendation? Thank you very much. And we move to the last item on the agenda for today, which is item 13, Quarter 3 Budget Monitoring Report. And we have Jane presenting for us. The report is on page 337.
Thank you, Chair. I'm Jane Wilby, Assistant Director of Finance and Accounting, and I'm here to introduce the Quarter 3 Budget Monitoring Report for 25-26 with a focus on Adult Health and Social Care Committee's budgets. So members will be aware that this report's already been considered by the Finance and Performance Committee, so today I'll try to keep the wider council context high level and focus mainly on the committee's budgets, performance, risks and key issues to note. At a council-wide level, the Quarter 3 position shows a continued improvement on our in-year finances. The forecast overspend reduced from 23.6 million at Quarter 2 to 18.9 million at Quarter 3, which was a 4.7 million improvement over the quarter. That improvement reflects sustained progress in SEND transport, some stabilisation in children's services, and the impact of stronger corporate spend controls and recruitment restrictions. However, it is important to be clear that the adult health and social care remains the most significant area of pressure within the council's overall position and therefore continues to require the closest level of focus and oversight. At Quarter 3, the Adult Health and Social Care Committee is forecasting an overspend of around 30.4 million against a net budget of approximately 168 million. So this reflects the scale and complexity of demand the service is managing, particularly in relation to care purchasing and complexity of need. The key driver continues to be care purchasing with an overspend of 30.9 million. This is driven by a combination of factors, including demand growth, as previously discussed with members, that was not fully budgeted for, estimated at around 9 million, a slippage in savings delivery in year, and partial delivery of recovery plans related to slip savings delivery in prior years. There are also smaller but notable pressures from contract overspends, including areas such as advocacy, care at night, mental health supported accommodation, and steps provision. So while financial challenge is significant, there is clear and active management in place. The key action is consolidating all those savings and transformation plans into a single, understandable programme, including the adult social care diagnostic, which will shape long-term reforms, but is not expected to deliver significant in-year savings. For Quarter 4, the service set 3 priorities, which was to increase review activity to reduce avoidable spend, improve forecasting reliability through strengthened validation and governance, and focus on influenceable pressures to minimise the impact on next year's budget. The actions were designed to stabilise the in-year position and protect service quality and safety, which remains the overriding priority. Members should be aware that there does remain a continued risk of overspend if the recovery actions are delayed or do not deliver at pace. Demand and market pressures remain volatile, particularly for complex packages of care. Relationships with health partners continue to be challenging, particularly considering the significant change happening in the sector nationally. At the same time, there are clear opportunities, further efficiencies through service redesign and workforce optimisation, contractual savings where services are no longer active or optimised, and stronger alignment between short-term stabilisation and longer-term reform. These are actively being overseen through strengthened governance and senior leadership involvement. Looking ahead, the Council now has a benefit of a multi-year funding settlement, which does provide some greater certainty over the medium term. It does offer some stability, but for adult health and social care, it doesn't remove the underlying demand and cost pressures, nor does it reduce the urgency of reform. For this committee, the medium-term focus remains on reshaping services to maximise independence and reduce long-term cost growth, embedding technology-enabled and preventative approaches, strengthening commissioning and market management, and aligning improvement activity with the wider Future Sheffield transformation programme. Future Sheffield is critical to moving away from short-term mitigations towards sustainable, long-term solutions while continuing to protect the most vulnerable residents. In summary, the Quarter 3 position remains significantly pressured with a forecast overspend of 30.4 million. The pressures are well understood and actively managed, with clear recovery actions in place, and the focus remains firmly on stabilisation now and transformation for the future, supported by strong governance and leadership grip. Happy to take any questions or explore any further aspects of the committee's budgets or anything within the paper. Thank you.
Questions? Councillor Mills.
Thank you. The reference to ongoing difficulties in relationships between the local authority and the NHS. The situation there is not resolving itself at pace, so that with the Integrated Care Board reorganisation having been put on hold and an extension or a renewal of the consultation process, so that's now taking longer than it would have done. What kind of uncertainties is that planting for us in the local authority? And have any risks grown since the last time we discussed this a couple of months ago? Have any risks grown in terms of the relationship that we have in trying to tackle continuing healthcare issues? Who pays for what in layman's terms? Is the risk greater to the council now than it was previously? Can you see slippage on the horizon because of that reorganisation?
I'm going to defer to Matt to provide further context, but I think you really set out exactly what those challenges are around the redesign of services and integrated health board and what that structure is going to look like, and it certainly does place additional challenges, but Matt can answer with some further context.
Thank you. I mean, the headline answer is that the risk is still present, and the risk moving into next year is increasing, not decreasing. In terms of what we're trying to do about that, the 4 directors of adult social care in South Yorkshire have collectively written to the South Yorkshire ICB. We've set out some clear asks in terms of how we'd like to engage to revisit the CHC process itself, accepting that responsibility for that is likely to move from place to sub-regional level. So it's important that we all shape that collectively. We do feel that there's some opportunities here about joint commissioning in terms of the new world that we're heading to. There is a very limited amount of extremely high-cost complex supply for care, which further fuels the cost of provision. So we are offering a cooperative and forward-thinking approach. I think realistically speaking, until the new ICB structure is embedded, it's going to take some time to get around the table and have those conversations in a way that drives change. We also need to be honest about the overall financial position of the ICB in South Yorkshire. There is further work going on for financial plans this year to be approved and ratified, and there is a significant overspend across that economy. Because of all of that, we will not only focus on trying to get the pathway and the process right, we will also look at a variety of other options in terms of making sure we work towards balance next year. I do think long term, if we don't get the CHC policy process and adherence to the national framework correct, you will note in the paper the single largest overspend by some distance is in the Adult Future Options Service. That is where we have the highest cost number of packages and the highest number of disputes in relation to what sits under NHS funding and what sits under council funding. So I would love to be able to allay your concerns further. At this point, I can't do that, but that is the approach we're taking to try and address it.
Thank you. It's what I expected to hear. I mean, good that did you say the DASs have all written collectively to the ICB about specifically continuing healthcare? So, yeah, good for you. I just wonder to what extent the local authority is finding itself a passive partner in the, as the ICB is working on a future operating model design, which I understand has not been widely available for scrutiny, even amongst the workforce who are being consulted about redundancies. A future operating model has not been seen, as I understand it, by many of the workforce. So people are working blind, really, and I just wondered to what extent the local authority has been allowed to be a consultee, whether you've seen impact assessments, whether there's any degree of co-production with the ICB on the things where it crosses into the local authority.
Okay, I don't think it would be appropriate for me to comment in committee on the restructure itself. The response to your question is we would welcome any opportunity to influence the future operating model. Thank you.
Thank you. Thank you, Councillor Milsom, for asking those questions. Are there any further questions? And obviously, we will have to have very close monitoring on that. I know that there is a lot of work in the background, specifically for adult health and social care and the transformation programme, and we're trying to kind of amalgamate things so that it makes more sense, but obviously it is worrying. So we will keep a close eye on this. Thank you very much. I'm bringing that to a close. The recommendations are on page 338. There are two. We are asked to note the updated information on the 2025-26 revenue budget outturn as described in this report, including the detailed committee budget monitoring information and management actions provided. And number two, to note the targeted actions and work underway to bring the in-year forecast overspend down. Are members happy to approve those recommendations? Thank you, Jane. So this brings to a close of our committee meeting today. This is the last meeting of the municipal year, and I want to take this opportunity to thank all the members and the officers that have contributed this year, particularly in the year that we've had the CQC inspection and all the work that has gone on, and obviously in the face of a really challenging financial outturn for the committee. And also take this opportunity to say that as we head towards the election, we don't know what's going to happen in terms of administration next year. So any of us, this could be our last meeting on this committee. So I want to, if this is my last committee, I want to say thank you very much for the last 4 years. There isn't a date for the next meeting. It will be sometime in June or early July, I assume. But it will be published with the AGM papers in May. So thank you very much to everybody.